begin whenever?
I think this is basically everybody. So
Okay.
thank you all for coming.
Yeah.
I'll introduce you.
Thank you.
Well, thank
Susan
you.
Connors. I don't know, nobody was talking.
There we go. I have my own introducer.
There you go.
Anyway, thank you all for coming today. I've never been in this particular school before, so it's nice to see a new one. And loved watching some classroom stuff today. I am a retired middle school teacher, and I love to watch elementary school. I never could have taught it, don't get me wrong. Halfway through my career, they brought fifth graders into our building, and I was freaked out. What? How old are they? But people say that about middle school also, so I guess it's what everybody enjoys doing. I'm also president of the Greater New York State Tourette Association of America, and I have spent the last 34 years founding and running the New York State chapter, and I also worked for the National Association after my retirement as their education specialist. And probably my biggest and most important credential is that I have Tourette. So there we go. I've got all sides of the desk covered. I've taught kids with Tourette. I come from a family with many, many people with Tourette. And I also was a teacher, so I've got it all covered. Anyway, it's probably one of the more complex disorders you'll work with. And sadly, and I know that because I was a teacher, we don't learn about it in school. I mean, how many of you spent more than 10 minutes learning about Tourette? I mean, they don't. I mean, you might mention it, and go over a brief explanation of it, but you really don't learn a lot about it. And it's very sad to me because I come from a family, as I said, with many people with it. And believe it or not, and I've always thought that, observing and being in a school setting most of my life. But the latest research statistics came out 2 years ago from the Centers for Disease Control, and they indicate that 1 in 100 children have full-blown Tourette or a tic disorder. Yeah, pretty shocking. It's pretty shocking, and I guess I never really thought that it was going to be that. I knew it was higher than we'd always reported, but I never thought it was going to be that high. It's right up there with the autism spectrum. That's very, very high incidence. So I think it's sad that so many people don't know enough about it because they just weren't taught about it when they really should have been. I spend a lot of my time going into colleges and universities and teaching classes and working with teachers who are already teaching, getting their masters, etc. And they're so excited to get the information and keep saying to me, why didn't we learn this before? Why didn't somebody teach us about this? And I keep telling them I couldn't agree more. I started with my symptoms when I was 6, but I didn't get a diagnosis until I was 36. And that's a long time to go without knowing what it is that you have. And it's not from lack of trying. We try, but there's just so little information out there. It's getting a lot better, but we're not quite there yet, okay? When I present longer presentations, I always start, I have a PowerPoint, and I start with a slide, and it's a picture of a teacher that's kind of slumped over her desk at the end of the day. And underneath the picture it says, if I had but one life to give for my country, it would be Billy in the third row. And I put that there because I was a teacher and I know those days. And of course the next slide I have to give something in there for the parents. The next slide is a little boy at his neighbor's door with a cup saying, my mother would like to borrow a cup of Prozac, please. But one of the reasons I have that slide there is because, for two very good reasons, it's one of the more challenging disorders you work with. The first reason is it changes all the time. And that's what's really difficult about Tourette. You see a set of symptoms and you think, okay, I got this down. And then all of a sudden, here we go, something brand new that didn't happen yesterday, or maybe won't happen in a week from now. And that is very difficult for parents and for kids to figure out, is that a tic? What is that? What's going on? The second thing is, for the last probably about 12 or 13 years, our National Association is referring to Tourette, which I'm also very happy about, as a spectrum disorder. Not the autistic spectrum, but the Tourette spectrum. And what that means is, if you're going to have Tourette, 99.99% chance you will have other neurological disorders. So Tourette can be just the tip of the iceberg. And underneath all that, you've got all kinds of associated things, that you probably will know more about when I talk about those, because unfortunately, those are better known than Tourette. But I'm going to start with the actual Tourette diagnosis, and please, ask questions along the way if you have any, questions. Just shout it out, raise your hand, whatever. I taught middle school for 33 years. I'm used to being interrupted. As I said before, it's a neurological disorder, and it's classified as a neurological movement disorder. But I guarantee to you that very rarely when people see people with Tourette, they think neurological. They often think behavioral, they often think emotional, psychological. I mean, believe me, I've heard them all in the course of my life. As I was driving here, and I stayed in Clifton Park, so I was very, very close. I had probably about a 5-minute ride to get here, and one of my Tourette tics is to hit my little finger on things. I do it constantly. However, I know what I'm doing, but people, who see me don't understand that. Now, when I'm sitting here, I'll do it, but when I'm driving my car, I hit the windshield of my car. I do it very hard. I've actually broken this finger about 5 times. That's how hard I hit it. And what people going by me think I'm doing is this. That's what it looks like. So, believe it or not, it's a rough day here in Clifton Park. I mean, in my 5-minute drive, 2 people went by me and did this back to me again. I can't be throwing Tourette pamphlets out the window or hold up a sign, Tourette on board or whatever. So you just kind of wave and smile and hope they don't come after you. But, it looks many times more behavioral than it does an actual movement disorder. I brought that up because of the fact that it is so often misinterpreted. Just some of the facts about it. 3 to 4 times as many boys as girls get Tourette syndrome. Now think about, I just observed the class with 3 boys and 1 girl. So there we go. And all neurological disorders I think are more prevalent in boys than girls. That's very common. Many more boys get ADHD, many more boys get learning disabilities. That's just the way it is. And so it's the same way with Tourette syndrome. It's a hereditary disorder, and sometimes it's really easy to pinpoint. In my family, my mother was the one who had it. And she was never diagnosed. She, lived her whole life without knowing what it was. I was the first one in my family to be diagnosed, but subsequently, we, my immediate family, not, extended family, we have 29 people diagnosed with Tourette syndrome. It's a big group, I'm talking about sisters and brothers and, their children and their grandchildren. So it tends to be run very much in families. Sometimes it's a little harder to find. And I always tell people, if you don't know who it was, start looking. I had a friend of mine she was from England, and she called me one time. She was visiting, and her son had been diagnosed a few years before then, and she called me up and said, I found it. And I go, what are you talking about? Just, Aunt Millie. It's Aunt Millie. We always just called her Crazy Aunt Millie because she has all these movements and crazy things. And she was just so excited to find out where it came from. It could be as kind of crazy as that. We also, there's kind of good news and bad news. It's the only movement disorder that you don't die from. And I think that's really good news for those of us who have it. I mean, you eventually die from Parkinson's, from Lou Gehrig's, from Huntington's. But with Tourette, it doesn't degenerate. It only affects voluntary muscles and never involuntary muscles. So for those of us who have it, it's great news, okay? The bad news about that is because what we need to study a neurological movement disorder is the brain. And because we don't die from it, we don't get a lot of brains to study. I donated my brain 23 years ago to the Tourette Brain Bank. It's at Harvard University, so someday part of me will get to Harvard. But, I was very disturbed last summer when they called me. I must have been getting close to this certain age, and they wanted to know how I was. I mean, do you really want to hear from the brain bank on Saturday morning? No. But we've only had about 8 brains to study, so we don't have as much good research. So because of that, we don't even yet have a medical test for it. I've had CAT scans and PET scans and you name it, I've had it, MRIs and all kinds of stuff. And we're getting a little closer with some of the scans that you see in the big colored image of the brain on medical shows, and they're starting to see some real abnormalities, but nothing to clinically diagnose it. So they diagnose it through 4 distinct criteria. And I'm going to go through this with you because I think once you see those criteria, you'll start to think of other kids you're working with or have worked with that you probably just didn't realize that that might be what it is. And they're very easy to pick out, not that we as educators can diagnose, but it is so important that you understand where the diagnosis comes from, not only for a child that may be in your class already diagnosed, but for other kids. Tourette is a disorder of childhood onset, and we're going to talk about that, and the average onset is between 5 and 8 years, so right smack dab where you guys are teaching. And so I think if you're going to see it, this is where it's going to start. But the first criteria, as I said before, it's a movement disorder, and we call these movements tics. That's what they're called. I think most people know that. And so that's the main feature of a person with Tourette syndrome. And I always tell people when I'm presenting, it's like show and tell. My head is shaking back and forth and my shoulders going, and I have a lot of extraneous movements that I can't control. That's as simple as that. And sometimes they're recognizable as tics. Sometimes they're very odd movements that don't look like tics at all. But the first criteria is you've got to have more than 2 or 3 of these tics. So they use the word multiple, but it doesn't have to be dozens of them. It can be even 3 or 4 of them, and that's enough to have the diagnosis. Now, the problem with the motor tics, and I observed it today when I was observing Elliot, and he's an interesting little kid because he has a combination of simple and complex, and I'm sure you've seen that, and those who work with him. There are simple tics, and the simple tic is the movement of one muscular group in your body, like an eye blinking, and that he definitely has, like a facial stretch. Like when I shrug my shoulder, that's just one muscular group, so that's considered a simple motor tic. If I shake my head back and forth, it's one muscular group. And I think most of us, if we saw a child doing that, you'd look at it as a tic. It looks like a tic. It's a movement that you can't control. It can affect any voluntary muscle in your body. However, at some point, most people will get complex motor tics. Complex motor tics don't look like tics at all. And they're very confusing, and I sometimes have to look twice myself. A complex motor tic, and I saw him do a couple of them, one of them was a hopping. He only did it twice, and I don't even know if you noticed because he walked behind you to come to the other side of the table, and he hopped, and then he stopped, and he hopped, then he stopped. And it was so clearly a complex motor tic. And it took him longer to get there because he had to do that little hopping thing. I've seen kids who have to hop, who have to twirl. I worked with a girl last year who would stand up, twirl, and then sit down in her seat again. What does that look like? It looks like a behavior. That's exactly what it looks like, but she couldn't stop doing it. And it's interesting, we all want to say to them, stop doing that, because it can be disruptive. It can be difficult for the child to continue their work when they're doing that interferes. However, they can't stop doing it. It's something, there's a chemical imbalance in the brain that affects what they call the dopamine system. Same brain chemical actually as with Parkinson's, which we'll talk about again in a second. And so they can't stop doing it. So what you will probably spend a lot of time when you're working with a child with Tourette doing is what I call environmental modifications. Like this girl who stood up and twirled. When I talked to the teacher, she said, well, it's really disruptive. And I said, well, let me observe the class and let me see, if I can come up with any suggestions. And the minute I sat down and started observing, I knew right away why it was disruptive. She was by far the tallest kid in her 4th grade class. So when she stood up and twirled, you saw it very clearly. The second most important thing was she was seated in the middle of the classroom. Now, I look at that as a teacher, and yeah, it was disruptive to stand up and keep twirling. However, I also look at it from the point of view of a kid who grew up with Tourette, and how embarrassing it is for that child to have to stand up, and everybody's turning around looking at her, and people were saying to her, why are you twirling? You stop twirling, sit down, stop twirling. And she's embarrassed, but she can't stop doing it. I've seen kids who have to bend down and touch the floor a couple of times, who have to, I'm working with a girl right now who has to bang on her desk, and things go flying off her desk. Probably the most unusual complex motor tic I've ever seen. And this girl did it for several years, and then it went away and came back again. And it was a handstand. Now, I know, when my mother told me, I'm like, she's what? I mean, who would ever think of that? But I went and observed her class Well, it was during the summer that she told me about it, and she said, do you think I should tell the teachers about it? I go, yes. As a teacher, yes, I'd like to know if somebody's doing handstands in my classroom. And, you know, she would get out of her chair, get up on her hands, stiffen up her body for like 20 seconds, and then back to her seat again. And it was just constant. She did it about 80 times a day, over and over and over again. And so we really had to think about it and figure out where we're going to put that girl in the class, how we're going to explain this to people. And she was 8 at the time, and she said to me, I've got it all figured out. She said, they're going to seat me by the classroom door, and then they're going to put a gym mat in the hallway. I go, okay, thank you. And then I'll try to run out in the hall and do it. Well, I was so pleased when I went back in and I did a peer-in service, which I do a lot of times for kids. And for the peer-in service, when I came in to do it after school had started, the teacher had put a gym mat out in the hallway, but she also put one next to the girl's desk. And she said, she doesn't have to leave. We're going to explain to everybody what she's doing. So if she needs to stand on her hands, just get out of her seat, stand on her hands. She's off to the side, so nobody's bothered by it. And believe me, after the kids understood, I never heard from them until IEP season in the spring. And I talked to her teacher one day, and I said, so, you know, how's she doing? And she said, fine. I said, did that tick stop? She goes, no. I go, and? She goes, and what? She's still standing on her hands, and everybody understands it, and we don't miss a beat. You know, and I think you can get to that point if people understand what it is. So you can have simple motor tics, but you can also have these very complex motor tics that can involve several muscular groups in your body and can look very behavioral at times and not necessarily like a movement disorder. You also have to have at least one vocal tic. And the vocal tic, most people have many more than one, believe me, but that's all you have to have. And a vocal tic is called that because you hear it. Now, when I'm presenting, I don't do a lot of my vocal tics, but when I'm not talking, I'm making squeaky noises, I'm knocking my teeth over and over again. There are words that I have to say. You know, I have a lot of vocal tics. I think that's one of the hardest parts of Tourette because, you know, if I'm sitting in a movie theater and my head is going or whatever, nobody's too bothered by that unless I'm sitting right next to them. But the noises get me kicked out all the time. You know, you can't be quiet, you've got to leave. I mean, do I look like a disruptive person? You know, no. But I understand now that how difficult it is to be in certain places because of that. And a vocal tic can be a simple vocal tic, and that's a noise you make. It could be anything from constant sniffing. That was my first vocal tic when I was 7. I was, you know, constantly sniffing, and the teacher eventually just got a box of Kleenex from my desk, and I would she would, every 3 seconds, would you blow your nose? You need to blow your nose harder. You need to keep blowing your nose. Has your mother taken you to the doctor? Mom always gets the blame, right? And no matter how many times I blew my nose, I was still going to sniff. It could be a throat clearing. It could be a cough. It could be the girl that had the handstand tic. She had quite a severe case of Tourette. She had a cough that developed later on that year. And it wasn't that it was that loud, but it was so deep in her chest that, I know this sounds horrible, but she broke a rib. That's how deep in her chest that cough was. I mean, really crazy things, you know, with this kind of disorder. It could be a little squeaky sound. It could be a grunting sound. Any noise you make that's kind of out of the realm of normalcy of what's going on around you. Animal noises are pretty common vocal tics, especially with younger kids. They'll moo or they'll meow. And, you know, just all kinds of things that might just look like silly, you know, behaviors. The complex vocal tics, and he definitely has some. What was the one you were saying last night he was doing? You're fired. A complex vocal tic is something linguistically meaningful that you have to say. You know, you have to say a word over and over again. You have to say a phrase or a little sentence. And you could do it, you know, a few times and you may not hear it again for a while. Maybe they'll never come back. You know, it's just, they're all over the place. And the one I heard him today, it was clearly a tic. He stopped and he kept saying, I love daddy, I love daddy, I love daddy, I love daddy. Isn't that sweet? That's normal. He said it over and over about 4 times, and that was it. You know, and you could just tell by the way he was doing it, repeating it, that it was a vocal tic. That's what it was. We have a camp every year that we run for kids with Tourette. And just to give some examples of some of the vocal tics, I have a boy this past year who had, his vocal tic was chicken. He just had to keep saying chicken, chicken, chicken. No matter what was going on around him, he had to yell out chicken. That was better than last year's vocal tic, which was Bob Dole. I kind of like that tick. I like that you're fired tick too. You wonder, you go to bed and you wake up with that, and you think, where the heck did that come from in my sleep? You got this new tick. And I asked this boy one time, I said, do you even know who Bob Dole is? He goes, no, my dad talks about him, so that became his new tick. I mean, I had a boy in my class, I was a French teacher, so I had him all 4 years that I taught, and we went from 5th grade animal noises, from the animal noise, he would moo and he would meow and he would he'd bark in class. We went from that to grunting sounds. When he got into 6th grade, he started with a much more complex tick, and he would say, chickens are fuzzy. Chickens are fuzzy. That lasted a long time. He liked that animal theme for some reason. When I had him in 7th grade, he had some vocal tics, but nothing too complex. I had him first period in 8th grade, and it was about November, and his mother sent me an email, and all the email said was, interesting new tick. I'm like, okay, I'm ready. I'm ready for this. Well, it was an interesting new tick, and I got the class started and kind of forgot about it. And all of a sudden, from the corner of my classroom, I hear, I got a chicken in my pants. Yes, that is a very interesting. And he kept that tick almost all of 8th grade. It just never went away. But what I think was one of my favorite memories of that day, and a very consoling memory, was that the first time he yelled it out, we had done tons of education, and everybody knew Marty had Tourette. They knew I had Tourette. And he yelled it out, and the 8th graders are not the kindest creatures, let's put it that way. The 8th grade boy sitting next to him turned around and went, wow, Marty, great new tick. And that was the end of the problem. He would, he'd yell it out, and the kids would just keep doing their work. The first time we laughed, you have to laugh, it's funny, you all laughed. But we weren't laughing at him, we were laughing with him because it was a funny tick. And they all said, great new tick, and then we moved on. And the only people who ever noticed it were if I had a visitor in the class, and, we would just ignore it, and the visitor's like, did anybody else hear that? Am I losing my mind? And it went on and on and on. So they can be, crazy things like that. They can be voice intonation changes are very common vocal tics, and that's where many times speech therapists get involved. You'll be talking, all of a sudden your voice goes up, and then your voice goes back down again. That's a vocal tic. One of my favorite in that category is, and my nephew had it, I work with umpteen kids that have had this tic, where they'll suddenly start speaking in a foreign accent. Just really unusual. My nephew went to one of the Carolinas on spring break one year and came back with a southern drawl. He lives up on the Quebec border. He's a northern boy. And he went on for months. I had a boy in my class with Tourette who came in one day speaking in the perfect British accent. And, we tried, and we got him into speech. We thought maybe schizophrenia. We weren't sure what the heck was going on. I kept saying, I think it's just a tick. I really think it's just a tick. And, it took about 6 months, and he came in one day and he was speaking American English. And we all welcomed him home. But again, such unusual types of things that you wouldn't really think of as a tick. And I think probably I've also seen many kids who have what could be a true stuttering, because stuttering is neurological, or they can develop a tick that sounds like a stutter. And I know I've had kids referred to speech, and eventually the stutter goes completely away with very little intervention. It was probably just a tick and it disappeared. So, a lot of times it's easy to tell if it starts when they're older. Like this one girl recently, she was 11 when she started with that tick, and nobody starts with a stutter all of a sudden out of the blue at 11, so I presumed it was a tick. And I think the one tick that unfortunately everybody with Tourette, everybody seems to know about Tourette, and that's the one that takes the form of inappropriate language. That's kind of, when I meet people and I tell them I have Tourette, that's the absolute first question I get. Oh, are you going to start swearing at us? Oh, you have that swearing disease? And a lady on a plane out to California one time asked me if I was sitting next to her, and I told her I had Tourette. And she said to me 4 times, are you going to start swearing at me? Are you sure you're not going to start swearing at me? And finally I looked over and I said, I may very soon. It will not be Tourette. If you don't stop asking me that question. It is probably one of the least common symptoms, but it's so sensationalist that TV programs love to focus on it and make it look like all of us run around swearing. It is a tic. It is about 15% of the Tourette population gets it. You can get it at any time in your life. Sometimes even young kids will develop what I call coprolalia, because coprolalia is the name of that tic. And what it is, it's anything inappropriate. Now, when you're a first grader, shut up, that's inappropriate, or poopy, or, that kind of thing. Those are the things they will say. And that, to them, is coprolalia because it's inappropriate. As you get older and spend more time, like on the school bus, you get a little more creative. And, it is difficult. They could be curse words, they could be sexual comments, they can be ethnic slurs are one of the worst. And I've worked with a lot of kids who will yell out the N-word, just really awful things. I had a very difficult case with a boy who was expelled, actually, from school. We got him back, but it took a lot of, involvement with the lawyers, and it was horrible. He was a junior in high school because he was at a school with a very large Native American Indian population, and he had a lot of good friends who were Native American. He had no prejudice. He went to their church with his family every Sunday. But every time one of the Native American students would do anything in class, all they had to do was raise their hand and answer a question. And he would have to yell out, "Spear chucker!" It was horrible. And he was so embarrassed. And they, got him on racial prejudice and all kinds of stuff. And, I had a suspicion that's what it was, because he had no history of that. Sometimes some of these tics can be very random. Like, for years I had the F word, and I still do occasionally. It's not as bad as, there are days when I was teaching I had to go out in the hallway. That's how bad it is. My other fellow teachers were very jealous that I could swear at the 8th graders. And just tell them it was a tic. I never used it though. But it's not something you want to do in front of your class. So you go out in the hallway. It's very difficult. But with most kids, with most people that have that symptom, Tourette is very suggestible. So you'll only do it when something suggests it. Like when a Native American, did raised their hand, answered a question, that triggered it in your brain. The analogy I give is, if you walk through a park and you pass 12 park benches and you don't have one desire to touch one of those park benches, you get to the 13th one and it says, "Wet paint, don't touch." The first thing we want to do is touch that bench. And that's what that particular tic is like. And it could be just about anything. I've worked with kids who have the most outrageous tics. The kids that have been kept home from school for an entire year. Really sad, because I think once everybody understands it, it's not a big deal. And if they're older, the kids have heard the words. Not like, I had a principal one time say to me, this little girl said shit. That's what she said. And she would say it over and over and over again. And he said, she can't come to school. We can't expose our other 7th graders to that word. 7th grade. And I looked at him and I said, "You don't get out of your office much, do you? If you think a 7th grader hasn't heard that word." One of my favorite ones was a little girl in Wisconsin that I did a private consulting job with. And her tic was every time she heard or saw the principal of the school, she had to yell out, "Kill the principal!" I know. And then it would be followed immediately by "Kill the effing principal." And, when I didn't know about that tic till I got there, and then they told me, and I thought, oh my God, I had no idea what I was walking into. But the principal was phenomenal. She said, I know what it is. I know it's a tic. I just want everybody else to understand, because she gets into so much trouble all over this building when people don't understand it. So we did a full day of educating kids and teachers and, cafeteria workers and everybody, and then things were much calmer for her. And so, a lot of things like that may look very behavioral are actually just that particular type of tic. So you can see
I just have a question.
Sure.
So can a tic be one time, and it can happen just once a day, and then it doesn't come back for?
Yeah.
Okay.
That's one of the criteria is what we call waxing and waning. Sometimes they last for a while, but I see some kids where they'll have it for, they'll say it Monday and Tuesday, and you don't hear it again till Friday, and then
And
you
it could
never
be
hear
just,
it.
they say it once and then you.
Yeah,
hear
it could
it
just
again.
random, yeah.
Okay.
And sometimes it's triggered by something in the environment that, like a few minutes ago, I talked about, I'm gonna do it now, sniffing. And the minute I talk about it, I have to sniff.
Okay, yeah.
I don't have a sniffy tick anymore. I haven't had it since I was about 11 years old. But I have to do it when I talk about it because it is very suggestible. So it's people ask me all the time with the particular tick, the inappropriate language, why can't you just say like duck or truck? Why do I have to say the F word? And my first response is, if I could, I would. Believe me. I don't want to be running around saying that word in grocery stores and whatever. However, what doctors suspect is happening, and this makes so much sense to me, is that we talk about Tourette is too much dopamine in your brain. That's what it is. With Parkinson's, you don't get enough, and it controls movement, so everything gets slowed down. You get tremoring, and you get shuffling of your feet, and your voice, speech can be affected. With Tourette, you get too much, and it misfires. And so they suspect that the misfiring of it is somehow affecting the system of inhibitions, which makes so much sense when you think about it. Where other people can inhibit, people with Tourette cannot. And they've come with the conclusion that it's the same phenomena that happens sometimes with people who have a stroke. People who have a stroke and all of a sudden become very disinhibited. Alzheimer's patients, you see a lot of it with Alzheimer's. And the other one is traumatic brain injury sometimes will result in people being very disinhibited, and that's what happens. And so it's got to be something very inappropriate that you say to satisfy that need that you have with that particular tick. So you can see the vocal tics and the motor tics are all over the place. The third criteria is what you brought up, and it's called waxing and waning, and that's, to me, one of the hardest parts of this disorder. It changes all the time. You just don't know from day to day what you're going to hear, what you're going to see. You may not see a tick for a while. Some of them will stay consistent, and you'll see them, like I noticed, is eye blinking and some of the facial things that seem to be pretty consistent throughout the day, or other ones you maybe only heard once or twice. They could disappear, and you may never see them again. They could last 6 weeks, and then, go for 6 weeks and come back 6 weeks later. It's just all over the place. And the waxing and waning is much worse in childhood than it is in adulthood. And I think you can understand that because the brain is changing so much that it's just, the disorder is constantly changing. As you get older, the tics don't change as much at all. I have some of the same tics I have now that I've had for 30 years. They just don't, like my teeth clacking tic I've done as long, I can't even remember how far back I've done that. And even though it's not the worst tic I've ever had for making a loud noise, but one of the things you have to remember about Tourette is that when you have a tic that you have for a length of time, it destroys whatever part of your body, is ticking. Like, that has destroyed all my bottom teeth. They all had to come out. They were all broken. And it was the tick that did it. And I've had them replaced with bridges, and I break the bridges. And the last time I saw my dentist, I told him I'm sick of sending him to Florida every year on my money. So I'll go buy a new car instead. And I think that's, one of the difficult things to keep up with is, and you will make a mistake, even parents. You'll have a new tick that you've never seen before, and it sometimes takes you a little bit, and you go, oh, wait a minute, could that be a tick? Because you've never heard it before, it's new to you. Waxing and waning, and this you'll probably see more of in school also, it also means that tics change in severity depending on environmental factors. And the biggies are stress and anxiety. When a child is stressed about something, is upset about something, if there's testing coming up, depending on the age of the child, something stressful has happened, their tics are always going to get worse. They also get worse, and here's what I used to forget about, when they're excited. So if you've got a holiday coming up, or it's the kid's birthday, or vacation, or whatever, you're going to see an upsurge of tics because they get so excited, that they kind of get stuck on that, and that increases the tics. A lot of our kids get worse tics when they overheat, which sounds really odd, but it does. I have many, many kids where after PE, after sometimes lunch, because the lunchroom can be hot, they have to go down to the nurse and have a cold pack put on their neck kind of calm the symptoms down. You know, it's kind of strange, but it does seem to happen with a lot of our kids. You know, any environmental change that causes stress or anxiety or excitement is definitely going to make the tics worse. And, you know, sometimes I tell teachers, you know, the week before vacation, you know, plan it. You know, it's probably going to not be a good week, so put a plan in place. You know, he's going to need more breaks. He's going to need, you know, just something else in the environment. He's going to need maybe more, you know, OT activities. Whatever it is that helps that child calm down, I think that is a good idea to have built into the plan for that week before. Or if you know it's the birthday or something like that. You know, it's just kind of pre-planning because you know that it's going to be difficult for them. The fourth criteria is pretty simple, and that is, as I said earlier, it's a disorder of childhood onset. It always begins in childhood. The parameter ages are 2 and 18. I've never seen anybody beyond 18 starting with it. The average age is between 5 and 8, and it almost always starts around the face. Is that what his was, a facial tic? Yeah,
Yes.
it almost always starts around the face. Mine was eye
compulsive
blinking.
headbanger.
Oh, yeah,
As a child, as soon as he could get on all fours, he was
head banging.
for hours.
Oh.
We didn't get much sleep those years.
Oh, and that's, I've seen so many kids with that tic.
Put holes in the walls.
Yeah?
in
Oh, yeah.
His crib when he was doing it.
Yeah. I'm working with a girl now who bangs her head on the top of her desk, and you hear it, and it's just awful. So I've said, you've got to pad the top of her desk. We can't. She's going to give herself a concussion. And she's little, so the desk comes almost up to her head. You know, it's like, and you can hear that, oh my God, it's horrible to hear that noise and realize that that's her head that's banging against the desk. You know, they can be quite severe tics. But, you know, as they get older, the tics tend to move down the trunk of the body, and they can affect any voluntary muscular group in your body. And I think it's so important, especially for elementary, you know, staff, to know about this because that is where you're going to begin to see it. Now, I'm going to just kind of throw a quick sideline. There are actually 2 milder tic disorders that are not full-blown Tourette. And one of them, 100% you will see in the course of your career if you haven't already seen it, and it's called transient tic disorder of childhood. That's what it's called. Some doctors call it passing tic disorder of childhood. And what it is exactly what it sounds like. It's a child who will develop 1 or 2 tics that'll go on for a little bit of time, 6 weeks, maybe 6 months, sometimes even a little bit more than that. They disappear and you never see a tic again. Want to hear the statistics on this one? 33% of school-age kids have a tic. That was shocking to me. But when you look around your classroom, you see it all the time. And you know, when they first start with it, keep an eye on it. Most doctors will not diagnose it as Tourette until they've had the symptoms almost a year, because they want to see if it isn't just a passing tic. You know, you can usually tell before then, but they want to keep an eye on it. But it's very common. It could happen after you know, a rapid growth spurt, after a hormonal change. Traumatic incidents, believe it or not, trigger tics. And I used to think that was like, wait a minute, that brings us back to the psychological realm, and it's a neurological disorder. It does, except psychological or traumas of some sort cause brain chemistry changes very rapidly. And so it makes sense. But, you know, keep an eye on it. There's also one that's called chronic tic disorder. And a chronic tic disorder is an adult who will start with a tic when they're young. Usually is 1 or 2 things, very rarely more than that. The tic never changes, and it never goes away. And that is a chronic tic disorder. Now, the interesting thing is, a chronic tic disorder is a manifestation that you are carrying the gene for Tourette syndrome. And I see many, many families where one of the parents or a grandparent will have 1 tic, and they've had it since they were 9 years old, and it's never gone away, and they still have it, and that's a chronic tic disorder, but it's a manifestation that symptom is there. So that's when they use that 100%. I mean, 1 in 100 people who have a Tourette or a tic disorder, they put those 2 disorders in that grouping with it. So that's why there's so many of them. So that's pretty much what you have to have the diagnosis of Tourette. But as I said before, this is a neurological spectrum disorder. And I've never met a person, honestly, who has just tics. It's just never happened. Everybody has something else. Now, the 3 biggies, ADHD. Yeah, definitely saw that today. But he wasn't the only one. Yeah, ADHD is more common. I would say probably about 80% of our kids with Tourette have ADHD. The difficult part of having ADHD with Tourette is that not for everyone, but for some children, quite a few of them actually, stimulant medication that helps ADHD will aggravate the tics. And so it's a real difficult situation. Some kids can take a stimulant, it'll maybe make it a little bit worse, but they're still functional and that stimulant helps a lot with the attention. So that's not a bad thing. But some kids, I had 2 nephews who started on stimulants when they were quite young because they were diagnosed first with ADHD and, just insane. The tics were, just insane. They could not possibly stay on that medication. And so you see that a lot, so it makes it a really difficult disorder. And as you know, ADHD comes with, impulsivity, hyperactivity. As kids get older, the executive functioning skills are affected by it, so they're very disorganized and have difficulty keeping track of things. It's just so many things that come along with social immaturity is very common with kids with ADHD. You take their chronological age, you take 2/3 of it, and that's pretty much where they are. I mean, they're usually about a third delay behind their classmates, socially and emotionally. They may be very bright kids, but they have that social emotional delay. OCD is a very common one, and I know his mom has mentioned that he definitely has some OCD tendencies. OCD is probably the most closely related to Tourette. Of all the associated disorders, OCD, I have terrible OCD, and I've always called it tics in my mind. My body tics, my mind tics. I get stuck on something and I cannot move on from it. It's just not going to happen. And there are so many manifestations of it that it's really hard to sometimes figure it out. But I think the most difficult part of it is that you see the tics. You can see the facial grimaces. You can see, the arm flying out. I saw him do a couple of these things in the course of the day. He had quite a few, tics. But the OCD is not visible because it's going on inside your head. And so sometimes you have to look for red flags. I observed a boy recently in a local school who, the minute he sat down to write something, he would write a word, then he would erase it, then he would write it, then he would erase it, write it, then he would erase it, write it, then he would erase it. And, it was such a classic sign of OCD. Every time he wrote it, it didn't look perfect to him, so he had to erase it. And the teacher kept trying to hurry him along and say, just don't erase it, it looks fine. You're right. You can tell me a million times it looks fine, I'm still going to erase it, it's not going to stop. It's that chemical imbalance that's making you do it. And the solution to that is scribe for him, because it's slowing him down. Technology, with these kids, it's going to have to be their future for a million reasons, and it really helps a lot by using, tablets and any kind of computer technology. It really helps them when they're stuck on things, and now we have the voice activated and lots of great things that, I'll talk about in a second. OCD can be checking things. It can be counting things, and you don't count them out loud. I remember in 2nd grade, remember the reading groups they used to have, and they were all named after birds? The bluebirds, the robins. I was a good reader, so I was in the bluebirds, and I was very proud of being a bluebird. And all of a sudden, I developed an obsession, nobody saw it, nobody knew, where I would read 5 words in the reading book, and then I had to stop, and in my head I had to count to 25. I can remember it distinctly. Read 5 more words, count to 25. Nobody saw me doing it. And what the teacher thought is I didn't know what the next word was. So I went from the bluebirds to the robins. I think I ended up in the buzzards. It's a really awful word that I knew I didn't want to be in. And people say to me all the time, why didn't you just tell the teacher? Well, there's a good reason you don't tell. First of all, how do I know other people aren't doing this? I'm not telling anybody. I'm keeping it to myself. And not only that, I was so afraid that if I'd say something, people would think I was crazy. Because you feel crazy having to do something like that over and over again. I think everybody has a little tendency toward OCD, to the point that it probably doesn't affect your life that much. And that is very common. Like, there are people who can't leave their house unless they check certain things. Check the stove, check this, check that. If you're going back 2 or 3 times, I'd say you probably have some mild OCD tendencies, but I wouldn't put you into the category of having a disorder. But if you go back for the 10th time, I think you might want to consider. It would take me from the time I had my book bag packed to go out the door to go to school in the morning. As a teacher, I would put everything by the door, keys and everything, and I could leave my house 45 minutes later. That's how bad my OCD was. It was the blinds of the front window had to be perfect. And I would straighten, and I would straighten, and I would straighten. There were days when I would drive out of my garage and across the front of my house. They still didn't look right. I would go back. I mean, that's insane. You know, when you think about it, but I just couldn't stop myself. The bedspread had to hang perfectly even on all sides of the bed. I measured it every morning with a yardstick. I mean, you think about that, it was ridiculous. And then the stove, you had to touch the buttons on the stove. Then you had to plug and unplug whatever you had plugged in, so you got that feeling that it was unplugged. And you know, I went for a very long time before I was diagnosed with any of this, and I was diagnosed with OCD. At the time, I was diagnosed with Tourette. And I remember the doctor saying to me, you know, good luck because there's no medication for it. Like, that's not very helpful. And then finally, you know, a few years later, they came out with Prozac, and that was the first medication that worked very, very well. Not everybody can take it, but for me, it was a miracle drug. And the doctor tried to put me on it, but I'd been on some really tough medications over those few years, and I decided I wasn't going to try it. But there was one obsessive trait that came upon me one day, and it lasted about a week, and I knew I'd had enough of it. And I went to the doctor and got my Prozac, and it's still in my purse. It was quite a long time ago. I had to check the milk carton in the refrigerator shelf. Now this is irrational thinking. It really is. You know when you're doing it that it's irrational, but you can't stop doing it. And I had to check, the milk carton had to be perfectly straight on the corner, lined up with, you know, lines on both sides. Now, the rest of the refrigerator could be a disaster, but the milk carton was going to be straight. And I found myself one morning going back to my refrigerator for the 9th time. I mean, I could not get out of my house, and I kept thinking, you're not going to get to work today. You can't. It's too late to call in sick. You won't get a sub. You've got to go to work. So I pretended I had an IEP, and I had an accommodation, and my accommodation was that I got to bring my milk to work with me. And that's what I did. Now, on the way, I pulled through Dunkin' Donuts, and I got donuts for my homeroom, and I brought my milk, and we had donuts and milk, and they thought I was a nice teacher. No idea I did that because I couldn't get out of my house otherwise. And that's the point it can get. I work with kids who have, one of the traits that I see a lot with kids is what I have coined in my book, an obsessive sense of justice. I very rarely see a person with OCD, if things don't seem fair to them. Does that sound familiar? Oh, yes. Now we're going to diagnose Dad, right?
I'm not the yardstick though.
Yeah. You know, if it doesn't seem like if you give a student back a paper with a test paper with a grade on it, and before they get to their seat, they're turned around and they're at your desk again, you can sense a little OCD going on. You know, you might have given them a 93 and they think they should have deserved an extra half a point. And they won't leave your desk till you give them that half point. We've all worked with kids like this. They're kids who will tattle all the time because you didn't see it. That's not fair. Somebody got away with something they shouldn't have done. You know, if something changes, if you tell them on Friday we're having a pizza party, and then Friday the pizza that the pizzeria you were ordering from burns to the ground, and that's good enough reason to cancel a pizza party. That's not going to do for this child. They cannot let it go. I've done full behavior assessments around the obsessive sense of justice. I mean, it's just a real common trait with people. I have it myself, and I really have had to work over the years on it. You can have obsessions with, like I say, checking things, counting things. The list is endless of things you can obsess about. Perfectionism, straightening things. You know, having the cards all of each color have to all be lined up together. Everything has to be perfectly symmetrical. There's so many characteristics of it. And then you go into some of the more severe forms of it, like hoarding. We've all seen the hoarding show. That's a form of OCD. What we used to call kleptomania. That's OCD. It's a compulsion with stealing. I've seen it many times with kids that I've worked with, and it's not good, you know, and they just can't help doing it. So there are so many people who are very superstitious, and they, you know, an obsessive fear of something bad's going to happen if you don't do something. You know, if you don't step, like that old step on a crack, you break your mother's back. That kind of thing. So it's just go on and on and on and on. So it's just another kind of twist and turn. And then I'm going to talk a little bit about the learning disabilities, because they could be any learning disabilities. I work with tons of kids with Tourette, you know, constantly, and most of them have some sort of a learning disability. But it's interesting with kids with Tourette, they're often in the nonverbal areas, which is very interesting. One of the biggest ones that I see is what we call dysgraphia. And it is extremely common. I have it. I mean, dysgraphia is, as you know, a writing disorder, and it's got several components to it. You know, you can have one or two of them or all of them. It's a fine motor weakness, so you have a really hard time with fine motor skills, and to the point where it actually is painful to write. And you know, kids who have this will write the shortest thing possible because it hurts their hand so much to try to write. You know, I can write about 3 words and I have to shake my hand because it hurts that much. It's very painful to write. Because it's really painful to write, your writing is sloppy and messy and huge when it should be small, and you know, you don't keep margins. I was taking notes when I was watching your class, and then I went to put my notebook away, and I looked at it, and my notes go sideways. I didn't bring my computer in, so I did it on a piece of paper this day. I'm, of course, the only one who will ever be able to read that piece of paper because it's so awful. But they don't keep margins, they don't space between words, they don't put punctuation marks. And you know, OT is going to help them when they're quite young. They can strengthen those fine motor skills, but once they get to a certain age, you're not going to be that helpful anymore. And dysgraphia doesn't go away. It also, part of it is also copying things wrong. You know, they'll sometimes they reverse letters, not only the physical letter, but sometimes letters within words. I reverse like vowels in a word. If I write the word read, whether I write it or type it, I invariably type it or write it R-A-E-D. You know, I have a master's degree, I know how to spell read. And I look at it, and I go, why did you do that? And I know how to spell it. One kid said to me one time, he goes, yeah, that's what I wrote, but that's not what my brain told me to write. No, and that's exactly what it feels like. It doesn't come out the way your brain knows it should come out. And when they'll copy like an assignment from a board, and it may say page 10, 1 through 20, and they'll copy page 21 through 10. So they reverse things, they copy things wrong. And with a lot of our kids, you will find that it affects any ability to get thoughts down on paper. That's a biggie. And you know, they'll put the conclusion sentence at the beginning. They do really much better with graphic organizers. And I think, to me, I tell people all the time, I used to have dysgraphia, but I've outgrown it. And they look at me like, really? And I go, no, I have an iPad, I have a laptop, I have a telephone. I don't go to the grocery store unless I have my list on my telephone because I won't be able to read it. I mean, the sooner you get these kids in technology, the better off they're going to be, because it's going to be a lifelong problem.
Question. So, with the reversing numbers or something like that, do you not reverse them if you type them? Like,
when I'm typing, I do reverse them, yeah.
You still reverse them even when you type?
Exactly.
Okay. So it's not just the handwriting?
No.
Okay.
Well, it is, but that's part of dysgraphia affects handwriting, but it also affects writing letters backward, reversing letters and things like that,
Yeah.
whether you're handwriting it or typing it, which I always thought was very unusual. And I've done that my whole life. You know, I was a spelling bee champ every year, but then failed the spelling test. The teacher finally, you know, I grew up in the rural Adirondack Mountains, and she finally figured out that if I could just say it to her, and I would get it right every single time. But when I write it, if I look at it, I'll see that it's wrong, and I'll change it. But they don't always give you time to do that. They take your paper before you have time to go back over it again. So I was lucky. You know, people ask me all the time, how did you get where you are, you know, with all of this going on? Well, I grew up went to the last one-room schoolhouse in this state. Believe it or not. It makes me sound like about 100 years old. But a little house on the prairie days. But I grew up in a little town called Chasm Falls, New York, which is just over the Quebec border. And I went to a one-room schoolhouse for all 6 years of my elementary school. And in that school, the top number was 17 kids. And of the 17, 5 of them were my 6th sibling never went there. 5 of them were myself and my siblings. And every one of us had Tourette syndrome. So we did the math one day. 38% of my elementary school had Tourette syndrome. And I had a teacher who was beyond phenomenal. She will forever be my hero. She is the reason I became a teacher. Her name was Mrs. Paca, and she was just fabulous. She saw the tics, she heard the noises. My brothers were both very hyperactive, very inattentive. She taught us with her heart. I mean, there was never anything that we weren't going to be able to accomplish. And I think that's where I got where I am today. when I left that school in 6th grade, my mother put me in a parochial school. I started yelling out the F word, and that didn't sit too well. And I was suddenly the only kid in my class with Tourette. Life got a lot tougher, you know, because I didn't have anybody else in the room with it, and I didn't have Mrs. Spockham to take care of me. So we've got the dysgraphia. A lot of our kids, as you probably know, have sensory issues. Very, very common. You know, you all know much more about the sensory issues, the tactile and the auditory and the visual, and it really affects their lives so much, especially in areas where there's a lot of sensory overload going on. You know, in a middle school it would be a hallway between classes, or cafeteria can sometimes be too stimulating for them. Another disorder that's very common, again a nonverbal, is auditory processing. Very, very common with our kids. Sometimes it's, to the point where they really, really struggle. Sometimes it's mild and they can deal with it. But at some point, I like to see most of our kids tested for the auditory processing, because it is something that is quite common. And you can kind of pick it up if you know what you're looking for. I observed a boy last week, 2 weeks ago in Buffalo, and he asked the teacher in the middle of class if he could get a drink of water. And she said yes, and he got to the classroom door, and he started to walk out, and she said, "Jay, don't forget the pass," because she had a pass hanging by the door. And after she said that, he stood there for about a good 15 seconds, and he didn't move. And then he went, "The pass," and then he walked out the door. It took him that long to process what she was saying. He did get it, but he couldn't process it. So imagine if she says to him, "Take out your book, turn to page 3, you're on number 5C. By the time you get to the next 2 directions, he's still processing, "Take out your book." And so they get lost. Or, on a Saturday morning, if mom or dad say, "Before you go out to play, you need to take out the garbage, make your bed, and sweep the kitchen floor." How many of those jobs are they going to do? At best, one. And if you question them about it, they'll go, "You didn't tell me to do that. All they heard was the last one. I swept the floor." Yeah, they didn't hear the first 2. Or they heard the first one and they didn't hear the last 2. And it's something, all of these things, the dysgraphia, the sensory. Do you see the overlap with the autistic spectrum? That's so many times Tourette and autism are confused, yet they oftentimes go together. I know it sounds peculiar, but you can have Tourette without autism, you can have autism without Tourette. It's the associated disorders that overlap. Very few kids with autism don't have OCD. I mean, that's very common. And they also have perseveration on things. Sensory issues with autistic kids, very, very common. A lot of the same types of disorders, but it's not the same disorder. It's a different disorder. However, we run a camp, as I said before, every year with kids with Tourette. Last year we had one of our largest camps ever, and we take kids from all over the state, and we had 65 kids there. And of the 65, we had 12 on the autistic spectrum. So that's a pretty high ratio, 12 out of 65. So, but a lot of times Tourette will be mistaken for the autistic spectrum because they have social skills delays, because they have, sensory issues, and it may not even be that at all. So it's really difficult to tease everything out. I don't know if you know this, but we now have a really good Tourette clinic at Albany Med that's really developed quite a bit in the last 10 years. They now have 2 neurologists, a neuropsychologist, and a psychologist, and they do lots of the cognitive therapy for OCD and lots of really, really good stuff. They're wonderful, wonderful doctors. And so we've got a lot of good resources in the area now. But as you can see, if you had one of these things, it would be difficult. But when you pile, like I watched him today, and there were times when he didn't get things done as fast as he probably could have because he had to stop and tick. And you wouldn't think it was a big deal, but when you stop and tick, it distracts you. It just takes away from what you were doing. And then he's already got some attention problems, so then you got to go, okay, what was I doing? You got to go back to what you were doing. And, it makes it very difficult. So I think, when we talk about accommodations, I think breaks, but I know in your class you get lots of breaks, where they can sometimes just take believe it or not, exercise of any kind changes the dopamine level. Physiologically, it calms the tics down. And if it's a brisk walk, if you're taking a brisk walk even, down one hallway and back the next, it's going to immediately raise the dopamine, then crash it down, and then your tics are going to be much calmer. So there are, things like that you can do. And as he gets older, there are going to be tons of things. It's going to be the technology, which probably should start soon. The technology, you're going to have so many different types of things. And so much of it is going to depend on the tics that he's exhibiting, the OCD. I think the home and school communication will be huge. If he wakes up one morning and he's saying you're fired, it might be nice to know that. Because, if a kid came up and said that to me, I would be like, pardon me? What do you mean I'm fired? I work here.
I have a
Yes.
question on that one. So, he usually only says that when you're reprimanding him.
Mhm.
So, at
It
first I
looks-
thought, well, maybe he's just being a brat, but it could be
The stress,
the Tourette.
yeah, definitely.
How do you
And-
tell?
It's very, very hard to tell.
Yep.
I can usually tell. And the way somebody said to me, how do you know if it's just the kid swearing or if it's a swear word? Oftentimes it's the way they say it. If they repeat it, it's usually a tic. If they say it in a way that's maybe like, if somebody cuts me off in traffic and I say F you know what I'm saying? You can tell the way I say it. If I say it as stick, it's fuck, I say it like that instead. And so I can tell by that, I can tell how many times it's repeated. And if it's a stressful situation, very often it is a tic. And I think the best way is if that's what it is, just ignore it. Because sometimes then we'll think, how dare you say that to me? And then that brings the stress level up. It is very hard. It is very hard to distinguish sometimes. So I think the best thing is just ignore it. And, if they see it's not getting them anywhere, then they'll stop doing it. If it's a tic, then they'll probably do it again.
Can I ask a question?
Sure, absolutely.
So is a tick something that's rhythmic, or would it be?
It could be and it could not be.
Okay.
It's not even the rhythm of it, it's the intonation of it. Like if you're gonna swear at someone, you would say, damn it.
Right.
Whereas it's a tic, damn it, damn it, damn it. Just kind of like rote, no
Right.
rhythm to it. That's how I can usually
Alright.
tell it.
So if you're saying something and then laughing in between, or
Oh no, that happens too,
okay,
yeah.
all right.
One of the things I hear from teachers a lot is, well, we knew it wasn't a tic because the minute he said it, he looked around to see everybody's reaction. So he was doing it for attention. And believe me, that has happened to me 5,000 times in my life. If I'm in the middle of a grocery store, a big supermarket, and I yell out the F word, the first thing I'm going to do is look around and see who noticed. That's common human nature. So that's not necessarily mean that it's not a tic. I think the best thing is if they truly have something that they're doing for attention and you don't give them the attention, then it doesn't serve the purpose, so they're going to stop it. And if they don't stop it, then you're going to know it's not for attention. So my biggest thing is just kind of ignore it. And I think at some point, I think right now, he's pretty young, but at some point, it's going to be a good idea, with his parents' permission, of course, to educate the other kids. I can get a peer, we have what we call youth ambassadors that are trained all over the state. We have 2 very good ones in this area. The high school kids who come in and do a peer training with the class, and they went to Washington and did a 3-day training program, and they have all their PowerPoint and everything, and they're really excellent, and they're all kids that have Tourette syndrome themselves. And we have one now who's in college, but he's home a lot, and we have a girl in Guilderland High School who does it. And she does a superb job. She really does a nice job. I mean, think about it. I don't think right now the kids are I don't think it's a big deal to them at all, because they're pretty young. But sometimes when they get older, they start becoming more observant. And I would rather they know, the way I do a peer presentation, because I do them all the time, is by talking about everything and anything but Tourette to start out with. We talk about, how they're all physically different. Some of them have brown hair and some have red hair and curly hair and brown eyes and blue eyes. And then we start looking about maybe different disorders like asthma. And somebody invariably will have asthma and they'll talk about what it is. And have they ever seen anybody use an inhaler? And, and I go, well, what do you do when somebody uses an inhaler? Would you make fun of them? They go, oh my God, no. They realize that that's inappropriate. And I just kind of work my way into the Tourette. So by the time I get to Tourette, to them it's just another thing people get.
What about Tourette and aggression? And
Tourette and aggression, yeah.
Okay.
And to be honest with you, yes, probably a good share of my kids have what I like to call meltdowns, rage attacks. There are actually pamphlets written about it. If I look at the whole spectrum of disorders, the 2 or 3 things that almost always cause a meltdown are OCD, they're stuck. and they cannot move on. And that often gets them into a rage. You know, if they're working on something and they can't get it finished and it's time to move on, they can't let it go. They just cannot let it go. Change, transition, I loved, because you were going, in 4 minutes we have to do this, in 3 minutes we have to do this. Like, she's got it down pat, you know. And that transition, I noticed when you said the 4 minutes, he was kind of like, okay, 4 minutes, oh my God. And then after you went 3, then 2, gradually he got used to the idea that you're going to be putting that away and starting something else, and he was fine. But if you just said, no, you put that away right now, you know, because they're stuck on it.
Yeah.
The sensory issues often too. Sensory issues are sometimes
So
painful.
is the aggression like a tick, is what I'm asking, like, can they just be, you know, finding they have a tick that's aggression?
Right,
No.
like
No.
destruction of school property.
That's
No,
what I'm asking, or like
Only-
going in
only
and hurting another
inadvertent.
child or something.
Inadvertently. I've had kids who have this as a tick, and they will, you know, can do damage to somebody.
I guess I mean aggression towards other people is more of what I'm.
No, I have
Simply,
honestly.
I think it's what we're talking about, the, like coming out of nowhere, all of a sudden throwing something. Whereas that's not a tick, but
Right.
how
It's,
that might play the impulsivity
yeah,
aspect.
part of that is the impulsivity more than an act. Although I've worked with kids who have throwing ticks, that's not that uncommon. But many times, if it comes in the heat of, you know, something that's going on that he's annoyed with, it's probably more of an impulsive behavior. And you know, there's a doctor, I'm sure you've all heard of him, Ross Green, who wrote the book The Explosive Child. Fantastic. I've heard him speak. He's wonderful. And he calls the part of this, and what causes these meltdowns, is a developmental delay in the level of frustration, which really makes a lot of sense. You know, that's a 2-year-old would lie on the floor and kick their legs and have a temper tantrum, but a 7-year-old you wouldn't think would do that. But because that level of frustration is delayed, and that's why getting, you know, sometimes just what you say to them. You know, like a mother called me one time and said, you know, I put him on the bus this morning, and as he's getting on the bus, he was a 4th grader, he yelled out, Mom, what's for dinner? And I told him, oh, I think I'll have barbecue chicken, and he was all excited. Got on the bus, she went to work and came home and totally forgot she'd said it to him. I'm like, uh-oh. No, you don't do that. And she made, I don't know, something he liked, meatloaf or whatever. And the minute he got in the door and realized it wasn't barbecue chicken, it was the curtains off the windows in the bedroom, the bedspread on the floor. I mean, a full-blown meltdown. And it was because she had changed the menu. And she kept saying to me, well, what do I do? You know, there are going to be changes. I said, don't tell them what's for dinner. You learn that what's for dinner. Oh, I don't know. I'm thinking lasagna, maybe spaghetti. Yeah, maybe, you know what? I'll surprise you. Yeah, because if you tell them and you can't stick to it, that's that level of all day long, his obsessive brain has been thinking about barbecue chicken, and he gets home and she's changed the plan. And that is what happens. You have an activity at school and it has to be canceled. It's going to be a bad day. If there's a sub, it's going to be a bad day, because subs do things differently. I used to always know the OCD kids. When I'd come back from being out for a day, right at your desk. Do you know what that sub did? You know how you keep your stapler here? Well, she put it over here. Well, let's get that right back where it belongs. You know, they just can't take that transition, that change. They're very rigid in a lot of
But
ways.
I mean, those are conversations that we have with all the kids in our
Exactly.
types of classes. So
Yes.
that's fine that they're being a part of that social curriculum.
Oh, absolutely. Because they have
Flexibility
the
and change and what it
yeah.
means to
Right.
have the understanding about it, but
Yeah.
still talk about it and teach it.
Yeah,
'Cause
absolutely.
they all need it.
They all need it. They all need it. Absolutely. And I think the fact that I saw you on your thing on the wall, you have social skills incorporated right into part of their day.
Right.
And all of these kids need that. That's what a lot of them don't get early on, which is unfortunate, because they're not going to develop unless you teach them social skills. You know, they don't pick up on social cues. They stand. You know, how many of us have worked with kids who will stand right here when they talk to you?
Right.
Don't get space and stuff like that. So yeah, all of that is so important. I love coming to a school where I see that that's all being done at such an early age, because you're right, it's
Right.
good for all of them.
Especially in our program.
Yeah, oh yeah, absolutely, absolutely. So I think that the biggest thing is, you know, sometimes doing a functional behavioral assessment or putting together a behavior plan gets tricky, because you don't want to be punishing them for something that they can't control. Yet, you know, if they threw something, yeah, that's, you know, it's not a tick. Very, very rarely is it a tick. you know, but you've gotta figure out what was the frustration that caused it, and how can we alleviate that, or do things, say things differently to them. This little boy who melted down over the meatloaf, his teacher, when I went in the next day and visited with the teacher, he said, you know, this is what I get every single day. He said, it just happened this morning. He said, I have a rule in my room that at 10:30 we have snack time. And he had it written up on the chart, 10:30 snack time. And he said today we were correcting our math homework and we had one more problem to go, and it was 10:30. He said, well, I'm just gonna finish that last problem. I go, don't think so. You know, your chart clearly says 10:30 snack time. Now, not every kid's gonna be like this, but if you have really bad OCD, the minute the clock hit 10:30, Mr. Jones, it's 10:30, you said snack time, we're just gonna finish this problem, honey. But it's 10:31, you said at 10:30, it says it right, you know, and he won't let this go. And, you know, he said, what do I do? I said, well, we're gonna change the rules, and we're going to change what happens. And he goes, okay, what's my new rule? I said, the new rule is, every day when math is finished, we'll have snack time.
Get almost less.
Exactly.
Less rigid.
So then it doesn't, and that's the OCD part. And I wish I could say it doesn't go away, it gets better, but I still deal with incredible OCD. You know, even though I'm on medication, it's a lot better than it was. And along with the OCD, one of the major components of OCD is anxiety. And these kids have a level of anxiety that it's not always easy to see. I'm telling you right now, I'm probably working across the state with 15 kids that are not in school because of anxiety. I can't get them in the front door. They start throwing up when they get to the parking lot. Every little thing, they get into a full-blown panic attack. So we try, you know, working with a psychologist to do the cognitive therapy and gradually get them back into school. But a lot of school districts, believe it or not, won't allow you to come in just for one period and then have home instruction. You know, if you want a home instruction, you gotta be out the whole day. But the only way you're gonna get them back is to bring them back gradually, if they're really at the point where they're out completely. And it makes it really difficult to do that. So you can see it's such a complex disorder. And as you grow and the hormones kick in, one piece, which you won't know him at that time, but it almost always gets worse during puberty, as we could expect.
I have a speech-related question.
Sure.
I actually reached out to an old professor of mine who specializes in stuttering, and I know she had mentioned a high comorbidity
Yes.
between stuttering and Tourette's.
Absolutely.
And I have kind of relied on a lot of input from her
Yeah.
to differentiate between like secondary behaviors with stuttering and what
Right.
to intervene with versus the Tourette's.
Right.
And she had directed me with anything during speech that I'm seeing is probably related to the fluency
Right.
and that it's okay to intervene. But my question for you is, have you seen just speech related kinds of secondary behaviors that I just want to be careful with, like how I'm providing intervention with him?
Right.
And am I providing him with feedback? I've been really like shy of that because I know you're
Right.
supposed to ignore, but I
Right.
also know with fluency, it's very time sensitive. And
But-
before
but-
the age of 8, it's
Yeah.
so important to intervene.
Absolutely. He
You
didn't
know,
seem to
so-
be frustrated by it today when you were doing the
Not
sentence
at all,
at
and
all.
I found that he's so highly stimulable
Yeah,
in that
yeah,
structure.
Yes.
But I know he has, you know, again with dysfluencies and stuttering,
Right.
you know, he has decreased anxiety.
Yep,
It's one-on-one. It's a
yep.
quiet setting.
Right.
So there's a lot of like things going for him in that
Right.
structure, but then it's the generalization
Yeah.
that's
Back
tricky
into the
for him.
classroom. Yeah.
So
Yeah.
I guess I'm just struggling with like, does it make sense to keep intervening? You know what I mean? Like I'm not quite sure.
Yeah, I think
I
it does
struggle
make
with it a
sense
lot.
because it is common. A lot of, probably about, I'm gonna say just upwards of about 30 to 40% of our kids do have stuttering at some point in their life, because it's neurological,
Yep.
and any neurological
Yep.
disorder can go along with it. What I noticed was that when he stuttered a lot in the classroom,
Yeah.
but when he was in your room and you were, you know, calling his attention to it and everything was very calm, and at first I thought maybe I'll distract him from being while I'm there, but he didn't seem to even pay attention anymore to me. And I didn't hear one stutter when he was in your room,
I know.
not
It's
one.
really, he's so
Amazing.
highly
Yes,
stimulable with
yeah.
me. So, you know, I struggle with like,
Yeah,
I just wanna make sure, like I know it's helping him, but I
Right.
also feel like when you reach a certain point
yeah.
in a structured flow setting
Right.
like that,
Yeah, I think it's
So-
good because I think it's something, it's just one more stigma attached to, you know, an already difficult disorder.
Right.
You know, and I've seen so many kids that have that I think it's better to push through with it, especially he's so comfortable in your room one-on-one and he trusts you and, you know, he was so excited because he got through his 20
Yes.
total turtle, whatever. I can't remember, we go back in the classroom, and right away he said, I got through so many turtles slow or whatever it was called. I go, how do you remember that? I don't even remember what you.
Jody, are you wondering if you should have more sessions within the classroom?
So there's a couple things. So I guess part of my question is more like secondary behaviors of stuttering versus Tourette's. And I've been directed that it's okay to intervene as long as what appears to be maybe a tic, but it's called a secondary behavior and
Right.
stuttering, so whatever that may be, is as long as it's consistent only during his speech, that it's okay to intervene. But I just wanted to make sure that that's actually accurate.
Yeah, that is
Because
accurate.
Okay.
Good for your professor.
She's fabulous.
That's
why I
great.
went to her.
Yeah.
And then like I just want to make sure that, you know, you look at once you reach a certain level of accuracy, like he's kind of, I don't want to say like maxed out in the pullout session, but I
Yeah.
know it's helping him, but
Yeah.
like I feel like it would help to like bridge that like
Yeah.
generalization now because he is doing so well with
Yeah.
me.
Yeah.
That it'd be nice to kind of, that's
Yeah.
kind of I guess where I'm going with
So
this.
yes, you want
Yeah,
to
so you
And
want
Yeah,
so-
to kind of push into the
Yeah.
classroom. I like that
We
idea a
see-
lot, because
yeah.
I noticed a huge difference
Oh,
between, and I'm sure you have too. And I think he's so, you know, and it's not that he's not comfortable in the classroom, but
yeah.
things are not as
There's a lot of
quiet, and
stimulus.
there's more stimulation
Yes,
around
different
them.
environment.
It's a totally different
I
environment.
mean, I could even start by bridging it, like
Yeah.
one pull out, one push in kind
Yeah,
of thing,
yeah.
so he's still getting both.
Yeah.
But,
we can talk.
So he'll start
Yeah.
carrying through. But it
yeah,
was just
I
amazing to
wanna-
watch him. It's kind of like, you know, the person who has terrible stuttering and can sing without stuttering.
Yes,
You know, he got into that, and I've seen so much of that
yeah,
with people, and you know, but once he was back there again. But I think it's something I mean, I'm just so happy he's getting, I mean, you don't know how many kids I pick up when they're 11 or 12 and they've never had any of these services. I mean, it's hard to believe that it happens, but it does. And this is the key age to get these kids where they need to be. You know, early intervention is the solution to it. And if they get it early on, then you're gonna find less and less, you know, fewer and fewer problems with it as they get older. And I think it's so important. Even with the OT, I mean, eventually your muscles aren't elastic enough to really make a lot of progress. You can make a lot of progress when you get older. It's, even if you offered me OT now, it'd be a hopeless cause, you know? We have one guy who comes to our camp every year. I worked with him through school, and they didn't start OT with him until he was 12. And he never made much progress in it, and I know that he struggled, and we've eventually got him on a computer, and he did extremely well, and he went on to become, believe it or not, my financial advisor, making more money than I will ever make. And he comes back to our camp as a counselor every summer. And every year I come back and I threaten him I'm going to put him in the craft barn. Because his OT skills are, he goes, I could make those popsicle stick frames all day long. You know, but if he had had that intervention early on, I don't think he'd have the difficulties he's having now. I mean, you're still going to have difficulties. It's going to happen. But in the age of technology, it's not even an issue anymore. You know, I've gotten so many kids across the state working paperless, even in high school, middle school. You know, you can do it. It's so easy. Everything goes on the computer. We've got so many wonderful, I don't know if you may know about this app that I discovered. I spend my life looking for free apps because schools don't want to pay for them. The minute you say it's 99 cents, no. I want to hand them the dollar and tell them to go do it. It's called SnapType. Does anybody ever use SnapType? Oh,
It's like with Snap and Read.
Yeah.
The other is the app.
I'm not sure about that one. It's an Apple product, but you can get the same thing on the Google
Yeah.
platform in
We use it.
Notability.
We have students that use it.
Yeah, you take a picture of whatever you hand the child. You just take a picture of it and it comes up on the screen as a Word document.
Yep.
And you work, I started the research on it because I work with a little girl, a fourth grade girl who had to fill out a map of the United States. And I sat next to her and she started with California and she wrote California in such huge letters that it went all the way to Florida. I went, oh, I think we're gonna miss a few states here in between. Aren't going to have a label. and I started looking for something, and, I mean, we pulled it up on the screen as a Word document, just took a picture of it, pulled it up, and all she had to do was touch the state, and the text box showed up, and she typed the answer. And, I mean, for worksheets and those kind of things. I think, too, one of the things that I was always very aware of growing up was my handwriting was always very sloppy and messy and difficult to read. And, you know, now, I mean, people unfortunately judge you by what you produce and present to them. You know, I didn't want to be the only kid having their paper up there that nobody could read, you know, or their drawing that, whatever. And I think it just makes them prouder of their work and feel better and they know technology from very early on. You know, it's something that I wish we had growing up. I have it now, but it was a lot of years of struggle. I used to sit and type on the old typewriter when I was in college. What did they call that? Erase? Yeah. God, how many thousand times did I have to do that? Any other questions? Because I know we're getting short of overtime, actually. So, anything else? Well, thank you so much for staying.
Thank you
Really.
everyone for coming.
Contact me anytime. Jessica has my number. We've been back and forth, and just, you know, if you have any questions, and I'm gonna try to sit in on the IEP meeting or whatever when they have it. If I'm not here in person, I'll be on the phone. But I just wanna compliment you on, you know, doing so many early on things like that, because I think it makes a huge difference. He's a bright kid, I can just tell. He's a very bright kid. You know, he